What we've done is the dispatches of ambulances going forward from the 30th of April will transfer to the GHA, and what we've implemented as a part of that is basically a triage process. So somebody calls, they'll be asked some fairly basic questions by very trained and experienced call handlers.
The way in which ambulances are dispatched is going to change as of Tuesday the 30th of April. This is to ensure the sickest patients get the fastest response.
We've categorised those calls now into 4 categories. So anybody who calls and is deemed to be life-threatening will have a very quick dispatch, up to average time 8 minutes in terms of the dispatch. The next category is for what we'll define as emergency care, and the dispatch is within 15 minutes on average. There's then urgent care, which is a longer dispatch period, and then for anything that's less urgent, they will be assessed, the patients will be assessed and transferred to the 111 service, where they will be interviewed by, again, very trained clinicians who will review their conditions and look for and signpost people to other services. We've spent an intensive period over the last few months training people to dispatch ambulances, and that they've been trained in both physical conditions, mental conditions, in use of the new technology. It's been very, very intensive, the training that's gone on. We've had lots of demonstrations, we've had lots of preparation time, and we're confident now that the staff that we've got are incredibly well trained and will be able to respond to the needs of Gibraltar. We are very pleased with the way the new 999 service is running. What this will do is simplify the numbers. There are basically 2 numbers that people need to remember: 999 for any emergency care, or 111 if people need clinical care, but that they want to understand what their issues are, and they want some advice and they want some assurance and reassurance. The objective clearly is to go to the new numbers. It will simplify the situation. People will simply have to remember 999 or 111. What we really recognise is that for a period of time we need to have both systems running in parallel so nobody falls between the gap. So we're monitoring the calls to all of the numbers, and when we feel it's appropriate to step down the old numbers in the old system, we will do so completely and move on to fully onto the 999 process.